Let's talk policy portfolio. If we're serious about improving children's diets and reducing harmful additives, we need multiple approaches working in concert. Sugar taxes have gotten attention and implementation in various jurisdictions. Restrictions on synthetic dyes have gained traction in some places. But what if we combine these tools along with other policy levers? The modeling on this is compelling. Economists who study food policy interventions emphasize that single-prong approaches have limited impact. Implement a soda tax and consumption drops modestly, but people may shift to other sugary products. Ban artificial colors in one category and manufacturers might reformulate only minimally. But create a policy environment where multiple incentives push in the same direction, and you get synergistic effects that are greater than the sum of individual measures. Consider a hypothetical policy package: a volumetric tax on beverages based on added sugar content, mandatory warning labels for synthetic dyes, procurement rules that ban both excessive sugar and artificial colors from schools and government facilities, and grant programs to help small manufacturers reformulate with healthier ingredients. Each element addresses a different part of the problem. Together, they shift the market fundamentally. Evidence from jurisdictions that implemented comprehensive soda taxes shows significant consumption reductions, particularly among children and lower-income populations who are most affected by these products. The revenue generated, in several cases, has been earmarked for public health programs, including nutritional education and access to healthier foods. That creates a virtuous cycle. The tax discourages harmful consumption while funding programs that promote better alternatives. Public health advocates argue convincingly that artificial colors should be included in these policy conversations. They're closely correlated with high sugar products, serve no nutritional purpose, and carry their own health risks. Treating them as separate issues misses the common thread. These are cosmetic additions to junk food that make harmful products more appealing to children. The political challenge, of course, is fierce industry opposition. Food manufacturers and trade associations fight these policies aggressively, funding studies that question the health evidence, lobbying legislators, and running public campaigns about consumer choice and regulatory overreach. But the jurisdictions that have pushed through comprehensive policies demonstrate that political will, backed by parent advocacy and public health culling, can overcome industry resistance. The question isn't whether these policy combinations work. The evidence says they do. The question is whether we'll muster the political courage to implement them broadly.